Our speakers today will be Governor Tom Wolf, followed by Dr. Cynthia Chuang, Chief of the Division of General Internal Medicine at Penn State Health Milton S. Hershey Medical Center, then Secretary of the Pennsylvania Department of Health, Dr. Rachel Levine, followed by the Commonwealth's Director of Testing and Contact Tracing, Michael Huff. Now I'd like to open it up to Governor Wolf.
So thank you, Sarah, and everybody. Thank you for being here, Dr. Chuang. Michael, Secretary Levine, thank you all for being here. So what I'd like to talk about is the vaccine. I think we all would it to a certain extent. But when any new vaccine becomes available for the first time, there's always a lot of speculation surrounding it. Speculation about how safe it is, speculation about possibly how well it works, how effective it's going to be. And that's especially true with the COVID-19 pandemic, because we've been waiting for this vaccine for these vaccines for so long. So there is a lot of information out there about these vaccines, and sometimes it could be hard to tell fact from fiction, to know just what a rumor is or what's rumor and what's actually true. So today I want to share some facts about the COVID-19 vaccines being used in Pennsylvania, and you're going to be hearing more from Dr. Chuang in just a minute. But I want to share the facts to help more Pennsylvanians feel comfortable about getting vaccinated, because the COVID-19 vaccines are really an important tool in the fight, in our fight against COVID-19. But they're only going to be effective if Pennsylvanians actually get vaccinated. And we should get vaccinated because these vaccines are both safe and they're highly effective. It's what's going to take us through this. I've said before that I will not jump personally. I'm not going to jump in line to be vaccinated. I'm going to get the vaccine, and I can't wait. But there are people at high risk of contracting COVID-19 who should be in line before me, and they should get vaccinated before me. But when it's my turn, I'm going to get vaccinated, and I look forward to that day. I'm going to encourage my family members, and I'm going to encourage everybody in Pennsylvania to do the same thing. By the way, you don't have to worry about the cost. COVID-19 vaccines are being made available to all of us for free of charge in the United States, including through the many state-based exchange programs available through Penn here in Pennsylvania. And you don't have to worry about cost. And you also don't have to worry about safety. These vaccines are safe. They've been thoroughly researched. COVID-19 is an unprecedented global pandemic, and it elicited an unprecedented global response. When COVID-19 began to spread throughout the world, medical researchers and scientists, actually again all over the world, pushed other projects off their plates and committed themselves to the creation of a vaccine. And one of the things that has historically slowed down the development of vaccines is the lack of resources, the lack of money. But in this past year, researchers developing a COVID-19 vaccine were supported by immense investments of resources and money from governments and from nonprofits, with the goal of giving them all the tools they needed to work quickly and work effectively. We live in a time of groundbreaking research and scientific discovery, and when paired with the unlimited resources that allowed vaccine producers to develop safe and effective vaccines quickly, that was a great combination. Researchers and vaccine developers were able to use advances in vaccine technology developed over the last several years to swiftly develop vaccines now in use to combat COVID-19. And their success is a testament to the importance of the public investment in scientific discovery. It is impossible to get COVID-19 from the vaccine. And while some people might have minor side effects after receiving the vaccine that can last maybe a day or two, like aches, chills, low fever, or tiredness, like you sometimes get with a flu shot, that's actually a good sign. It means that the vaccine is doing its job and teaching your body how to fight COVID-19. By the way, it's the same thing that happens when you work out. Sometimes your body needs to recover from training when you build new muscle too. The vaccine is like a physical trainer for your immune system. It's the same principle. And sometimes your body needs a little more time to recover from training and build new defenses against the virus. I know that this year has been a hard one for all of us. Many of us are more tired, scared, stressed, anxious, just plain fatigued as we go about our daily lives than we ever used to be. And that's completely understandable. And it can make us maybe a little more wary of good news. But I'm here to tell you that the COVID-19 vaccine is safe to use. and very good at protecting people who are vaccinated. So if you hear a rumor about COVID-19 from a friend or see something online that concerns you, take a few minutes to verify the information before you get too worried about it. You can always find accurate, up-to-date information about vaccine safety and distribution on our website here, the Pennsylvania Department of Health, or you can go straight to the Centers for Disease Control and Prevention and find out from them. Either way, this is a great thing for Pennsylvania. This is the light at the end of the tunnel. Let's go out and get our vaccines. And now, for a doctor's perspective, a real doctor. I'm a PhD, but as my mother always reminded me, I'm not a real doctor. Vaccine safety, I'm going to turn things over to Dr. Cynthia Chuang, Chief of the Division of General Internal Medicine at the Milton Hershey Medical Center. Dr. Chuang.
Thank you, Governor Wolf. Dr. Wolf, thank you very much. Very excited to be here to share a few words about what we know about the COVID-19 vaccine in terms of safety and efficacy. We know that there's 2 vaccines currently that have been approved by the FDA under an emergency use authorization. And what we know about these vaccines is derived from really rigorously performed clinical trials. And these clinical trials included participants of all ages, racial and ethnic backgrounds, and different health conditions. So these trials really did a great job of representing our population. So these trials demonstrated that the vaccines are highly effective, like Governor Wolf said. The vaccines are the Pfizer-BioNTech vaccine and the Moderna vaccine, which were shown in those trials to be 95% and 94% effective at reducing the risk of symptomatic COVID infection. 95% and 94%, that's really remarkable. So just to give a comparison, our seasonal flu vaccine, which we rely on very much, usually ranges between a 40 to 60% efficacy. So the efficacy of the COVID vaccines is really remarkable. So how about safety? Like Governor Wolf said, you know, there are some common expected symptoms that we should all be prepared for. Like all vaccines, you may get some injection site symptoms. There might be a little soreness, there might be some swelling, there might be some redness. Expect that. 80% or more of people are going to get those types of mild symptoms. Similarly, you may get symptoms like a low-grade fever. You may feel very tired. You might get a headache. You might get some muscle aches. Probably 50% or more of people are going to get those symptoms, but they're mild. They will be resolved within 1 or 2 days after getting the vaccine. They should be expected, and they're mild. And like all vaccines and all medications, you know, some people will have an allergic reaction to the vaccine, but I want to assure you that those have found to be very rare, luckily, so far. So we know that as of December 23rd, there were nearly 2 million doses of the vaccines administered, and there were only 21 cases of severe allergic reactions reported at that time. So that is 11.1 cases of severe allergic reaction per million doses administered. So those are rare events, and I think that's remarkable. I'll just conclude by saying that as a healthcare provider, I was very lucky and happy to be one of the first people who received the vaccine. I got my vaccine right before the Christmas holiday. I can't wait. I am so excited. I cannot wait to see my patients. I'm a primary care physician. I can't wait to see them be offered the vaccine. I have conversations with my patients on a daily basis. They can't wait. They are anxious. They are asking me very good questions about the vaccine, and they are looking forward to getting it, and I'm looking forward to them receiving it. So thank you for that. I'm excited to, lucky to pass the microphone on to our Pennsylvania Secretary of Health, Dr. Rachel Levine.
Well, good afternoon, and thank you, Dr. Chuang, and thank you, Governor. Our mission to immunize any Pennsylvanian who wants a COVID-19 vaccine continues. The Federal Pharmacy Partnership has set up vaccination clinics at 159 skilled nursing facilities or nursing homes this week. Vaccine providers have administered 16,925 COVID-19 vaccines since yesterday's report, and that brings the statewide total of vaccines administered to 311,477. This includes 251,133 individuals who have received their first dose of the vaccine, and 30,172 people who have received actually 2 doses of the vaccine, and they are fully vaccinated. In addition, more than 52,000 residents and staff of skilled nursing facilities have now been vaccinated, and this is through the federal pharmacy partnership with CVS and Walgreens. Now, we know that an additional nearly 138,000 doses have been allocated for the state this week, and so far, 107,600 of those doses have been received, with more doses coming Wednesday, Thursday, and Friday. I strongly encourage healthcare workers who are in Phase 1A, who are not affiliated with a hospital, to now go to the map on the vaccine page of our website to see where they can go to be vaccinated. Each vaccine provider in Pennsylvania is listed now, and we have indicated whether or not they currently have vaccine, and of course the contact information for you to register to get vaccinated. We sincerely want you to get vaccinated as soon as possible. Pennsylvanians are ready for the vaccines. Now here's what you can do to get yourself ready. Please talk with your healthcare provider, as Dr. Chuang was talking about, to confirm that you are a candidate for to the vaccine and to answer any of your questions about it. Visit our website at health.pa.gov for the latest information. And please, everyone needs to keep up the great effort to stop the spread, to mitigate the spread of this virus. Please wear a mask, wash your hands, social distance, avoid large and small gatherings. We must have patience, as the amount of vaccine available to Pennsylvanians is still limited, and it will take time before there's enough vaccine available for everyone. So we must demonstrate our personal and collective responsibility to each other by following the basic mitigation message that we've been discussing. And at this time, I'd like to turn things over to our contact tracing and testing director, Director Michael Huff, to give us an update. Director Huff.
Thank you, Dr. Levine, and thank you all for being here this afternoon. Good afternoon. As Dr. Levine just reported, with vaccination administration for COVID-19 underway, Pennsylvania is moving in the right direction to safely get all of us closer to our normal way of life in the new year. Today, I continue to be encouraged about Pennsylvania's continued response regarding COVID-19 testing and contact tracing. Robust COVID-19 testing continues in Pennsylvania. To date, nearly 9 million test results have been received by Pennsylvania. And since initiating the Connect and Protect form for contact tracing, there has been a major increase, with over 6,000 calls being made last week to patients. And inbound calls were over 3,000 from patients in one day. Since implementation of the contact tracing management system in October, 76% of the contacts have been identified and reached for quarantine and symptom monitoring, a significant success. In addition, our COVID-19 testing provider continues to offer regional testing in 5 counties each week, as well as over 900 testing sites throughout the Commonwealth. Last week, the regional testing sites were in Crawford, Dauphin, Lehigh, Somerset, and Union counties, and tested approximately 6,700 individuals, a significant number. This week, the regional testing sites are in Bradford, Clarion, Fulton, Lancaster, and Pike counties, and will conclude this Saturday. The locations for next week's regional testing sites will be announced later this week. And as a reminder, testing is available 9 to 6, no appointment necessary, first come, first serve. completely free to all patients. Patients are not required to show symptoms of COVID-19 in order to be tested. You're encouraged to bring a photo ID or insurance ID for your identification, and registration will be completed on site. Individuals who are tested should self-quarantine while they await test results, and individuals who live with other individuals should self-quarantine in a private room or use a private bathroom if available. Others living in the home with individual awaiting test results should also stay at home. The Department of Health has additional instructions for individuals waiting for COVID-19 test results on their website at health.pa.gov. Individuals who test positive will receive a phone call from AMI, while individuals who test negative will receive a secured PDF. As we explained, widespread access to the vaccine will take several months, and communities across Pennsylvania continue to report high levels of new infections and hospitalizations. This current reality must serve as a continuous reminder to remain vigilant and ensure the safety and well-being of our families, friends, and communities. Our approach to COVID-19 testing for the late winter spring reflects the current reality and our commitment to keeping our communities safe. Our goal continues to be providing easy access to testing for the community, especially those populations who are vulnerable or at higher risk, to increase safety and decrease exposures from those who may be symptomatic, as well as those who may be asymptomatic. In other words, those not experiencing COVID-19 symptoms. Even though the hope is that there will be a COVID-19 vaccine available for most people sometime this year, the vaccine does not override the importance of continuing to test for and contain the virus to stop its spread. The virus remains a very real threat, and one that we must take seriously by following existing mitigation orders and continuing to test. Ultimately, all protective mitigation measures, testing, vaccinations, work in conjunction to provide a safe and healthy Pennsylvania. Throughout this pandemic, we have benefited greatly from tremendous testing partnerships that allowed us to administer nearly 9 million COVID-19 tests across Pennsylvania. Given infection rates in Pennsylvania and elsewhere, our public health team will focus on increased surveillance to ensure we can quickly and effectively identify and isolate instances of infection in our communities. So, as Dr. Levine reminds us, wear your mask, wash your hands, please social distance, avoid large groups, download our COVID-19 alert app, and answer the call and participate in case investigations and contact tracing. And now I invite Governor Wolf back to the podium and turn the questions over to Sarah. Thank you.
Thank you, Director Huff. Because we do have a limited amount of time today and we have many RSVPs from our reporters, we'd like to limit our reporters to one question, please. Our first reporter is from the Associated Press, Michael Rubenkamp. Go ahead, Michael.
Governor, have you heard any specific information that armed groups are coming to the Capitol or anywhere in the state for that matter? Have any specific threats been made?
No. But, I mean, we're ready for anything that might happen, but we have not heard anything specifically.
Thank you. Next, we have Asha Prihar from PLS. Go ahead, Asha.
I have a question about the UK strain of the coronavirus. I know we've seen just one case of that in Pennsylvania thus far, but I was curious about how testing for that works and whether labs are testing for this when they're testing just like regular COVID samples, or if there's some sort of special process to detect this variant. And if so, are we doing that to detect any potential community spread if there have been any cases of that strain that have like flown under the radar thus far?
Thank you for that question. So it does involve special testing, and this is being coordinated by the CDC nationally. And so that Pennsylvania, along with other states, send a certain percentage of our samples, especially samples that have a high viral load, that have a lot of virus present, to the CDC and or other laboratories that they designate. And then they do genetic analysis of those samples to look for the UK variant. And so it involves, again, special testing. Again, in Pennsylvania, we have only seen one of the samples that we have sent. We are working with our state laboratory in Exton to be able to do that genetic analysis on site, and we hope sometime maybe later in February that we'll be able to do that.
Thank you. Next, we have Ryan Eldridge from CBS 21. Go ahead, Ryan.
Secretary Levine, I think you could handle this this question. The Operation Warp Speed, they had a briefing this morning where they urged states to move to phase 1B. My question to you is regarding cost, administration, and logistics. Is Pennsylvania prepared to do so? And as far as the cost is concerned, do we have a grasp on what the state needs financially to make that happen?
Sure. So we're still waiting to hear the exact information recommended by Secretary Azar and the exact plan. My information is they're not recommending just going to 1B, but they're recommending that we start vaccinating those 65 and older, which is one portion of 1B, but it's not the entire portion. So we want to see the whole plan as they're rolling it out, and then we will certainly study that and look at the impact upon Pennsylvania, and we will follow federal guidance. In terms of the cost, we do have in the new stimulus package approximately $100 million that'll be for Pennsylvania for vaccinations. And so we're looking forward to receiving that money, and that will cover the costs of all of the different measures that we need to do, large vaccine clinics and sites, et cetera, to get the public vaccinated. But in terms of Secretary Azar's comments, we want to wait to see the whole plan in writing, and then we will work to implement.
Thank you.
Thank you. Next up, we have Bill Kibler from the Altoona Mirror. Go ahead, Bill.
Thank you. Alex Azar today said among his remarks that the perfect was the enemy of good, and that the states shouldn't micromanage, the states and hospitals, I guess, shouldn't micromanage distribution or administration of vaccines. I was wondering if you could talk sort of philosophically about that. Well, what the right balance is between prioritizing and getting it out to as many people as possible.
Well, I think you used the right word. I think it has to be a balance. So we certainly want to make sure that we follow through with vaccinating the populations that were outlined in phase 1A. So that included all of our healthcare workers, those in the hospital, but then other healthcare workers that are outside the hospital. That includes, for example, EMTs, but other physicians and healthcare professionals in their offices that might be seeing COVID-19 patients right in their offices. So we want to make sure that those people do get vaccinated. And then the other part of 1A were seniors and staff in long-term care living facilities. So that includes nursing homes and then other facilities such as personal care homes and assisted living facilities. We're working to implement that. Now that mission is being handled by CVS and Walgreens. But I understand his point is that we do want to make sure that we get vaccine into arms. And I had said this last week and I said this today. I mean, if a hospital or other vaccine site doesn't have someone with 1A, but they have someone from, for example, 1B, and the vaccine would go to waste, please give the vaccine. We don't want any vaccine to go to waste, and we want vaccines to get into arms. The vaccines themselves are wonderful, but it's actually vaccinations that will protect us from COVID-19. Now, there's new information, as we just mentioned, from Secretary Azar, and after we see it and study it, then we'll work to implement the federal guidance.
Can I just
Yes, Governor, please.
Let me just add some to the question. I know you didn't quite ask this, but I'd like to give a nod to the Secretary of Health and the Department of Health. They have done a phenomenal job of getting this out in really tough circumstances. And I think if you look at the statistics, and you can look at it one way, the percentage of the Pennsylvania population that has actually received an injection compared to the rest of the country, it's about 2%. And that's where the country is right now. If you look at the percentage of vaccines that have been delivered that have actually been injected into people's arms, it's about a third, which is, we're slightly ahead of that, I think. That's a third for the nation. We're slightly better than that. So we're doing a really good job, and it's thanks to the leadership of the folks at the Department of Health. So,
thank you, Governor. Next up, we have Bob Mayo from WTAE. Go ahead, Bob.
As you look to move forward with following the federal guidelines of vaccination of wider groups, what assurances will be in place that those people, like independent medical practitioners, non-affiliated EMTs and medical staff, will still get the set-aside that has been discussed, number one? And number two, what can be done to assure that while not wasting vaccine, as things are being done through municipalities, that people aren't jumping the lines, so to speak?
Mm-hmm. So, I mean, we're going to make sure that hospitals and federally qualified health centers, county municipal health departments, pharmacies are immunizing those in 1A. And we're actually making connections between hospitals that say that they're ready for more people and practices and other healthcare providers that need the vaccine. So we'll do everything we can to kind of marry those two together. We've had phone calls with Pennsylvania Medical Society and other stakeholders to do that. So, I mean, they need to do that locally, but we'll work to facilitate that, and we'll work to continue to facilitate that until that mission is complete. Now, the new population that has been, again, stated in the media, but I actually haven't seen the plan yet, was those 65 and older to start to get vaccinated. And of course, we can check that because we can see someone's identification on their age. And so we want to make sure that those individuals get vaccinated too. And according to the federal guidance that should be coming out soon. And then Walgreens and CVS are working on the long-term care mission, and they take vaccine to the facilities. They go to nursing homes, and they're vaccinating staff from the nursing home, as well as patients that are living in that nursing home. So we have had no reports of people jumping the line, so to speak. I'm sure that might happen across the country, but we have heard no reports of it in Pennsylvania. And of course, we'll be watching for that. We want to make sure that people are following the guidelines. In the end, we want everyone who wants a vaccine vaccinated, and we'll be continuing to work relentlessly towards that.
Thank you, Secretary. Next, we have Jim Melward from KYW. Go ahead, Jim.
There seems to be sort of a back and forth here with the CDC saying states are going too slow, but we've heard from you that it's challenging because there isn't the communication necessary. And I'm trying to cram this question in really quickly, so hopefully you get the nuance. That there isn't the communication that you guys would like as far as this is how much you're getting, this is where it's going, and that's been the challenge. From your end, I mean, what would you say to the federal government, to the CDC, about how they can streamline this to make you guys better at it?
Sure. So we talk with the CDC all the time, and we talk with Operation Warp Speed all the time. And so what we need from Operation Warp Speed is more specific detail about how much vaccine we're getting and exactly when we're getting it. We want to know how much vaccine is going to go to specific hospitals, and the more detail, for example, that we have about that, the better that we can prepare. In terms of the CDC, I know there's continued discussion, and I think that this is a natural balance between wanting to prioritize certain at-risk groups and with a very strong health equity lens, and the other is speed, getting vaccine into arms. I think that's a natural tension, and we want to find in Pennsylvania and really throughout the nation the right balance in that. And I think that the adjustments that are being discussed today by Secretary Azar are progress towards that. We know that the President-elect Biden's administration says that they're going to come out with a plan maybe later in the week. There was a news report about that, and we'll look forward to that. As part of ASTO, the Association of State and Territorial Health Officials, we have had regular discussions with the Biden transition team and discussed that tension between prioritization and health equity and getting vaccine into arms.
Thank you, Secretary. Next up, we have Erin McCarthy from the Philadelphia Inquirer. Go ahead, Erin.
Hi, Dr. Levine and Governor Wolf. Alex Azar said today, as we've talked about many times now, that they will change their allocation to states in 2 weeks based on the pace of the rollout and the size of the 65 and older population. If you do see that plan in writing, will you amend Pennsylvania's 1B group and advise providers to give vaccines to people over 65 in 2 weeks?
Absolutely. So we plan to study that, the data and the plan that comes out from Health and Human Services and the CDC, and then we will work to implement the federal guidelines. You know, it'll be we're very pleased to see more vaccine coming, that they won't necessarily be storing the vaccine for the second dose. But that depends upon, I mean, really their granular knowledge of the supply chain, which the states don't have, that dose will be there for this, that vaccine will be there for the second dose at the right time. So that's a balance too between getting vaccine out, but everyone agrees in the United States with the FDA's recommendation that we have to follow the science and everyone needs to get the second dose of both of the vaccine that they received.
Thank you. Next we have Ron Southwick from Penn Live. Go ahead, Ron.
Yes, good afternoon. I wanted to ask a question about dealing with some of the skepticism people have of the vaccine, specifically in minority communities, communities of color. Can you talk now about the steps that are being taken now to try and convince people that might have a well-founded skepticism of vaccines about the importance of getting this vaccine and what efforts are being undertaken to engage community leaders in minority communities about engaging them in the effort?
Sure. So we have engaged community leaders. We have regular conversations, for example, with the Pittsburgh COVID-19 Black Coalition about engaging African-American community in Allegheny County and in Pittsburgh. We have other discussions as well. We've worked with our commissions. And we have a vaccine communications plan that we will roll out after we get the funding from the federal government to be able to actualize that. In addition, you know, I've called before is that we need a federal communication plan about the vaccine. We need that we can then dovetail with. We need a federal plan, a federal communications message that is coming out about the safety and the effectiveness. But if I might ask Dr. Chuang if you would like to talk about dealing with vaccine hesitancy with your patients. I don't know if you can hear me.
Thanks, Dr. Levine. Yes, I think that this is a conversation that we're having quite often. And, you know, the way I would address the question is just saying these are one-on-one conversations that as healthcare providers, we're really interested in having with our patients. We've had lots of conversations with each other about how we've been having conversations with our patients, answering questions. And I think that is the best way to talk about it, normalize it. We've been telling folks that we've been getting the vaccine and how our experiences have been. We share why we get the vaccine, and we're doing our best to get out to all of our local communities so we can reach as many people as possible.
Yes, as the governor said, the $100 million in funding will help a lot.
Thank you very much. Up next, we have Jim Deegan from WLVR and PBS 39. Go ahead, Jim.
Hi, Dr. Levine. Thanks for taking my question. Even using the numbers that you've supplied, only about 1 in 3 of the vaccine doses that Pennsylvania has received have actually been administered to this point. I understand that the shipments of the vaccine are coming from the federal government, but what's causing some of the holdup here in Pennsylvania once the vaccine arrives in Pennsylvania?
Sure. So I've talked about this before, but I want to emphasize it, is that, for example, we have not received all of the vaccine that has been, quote unquote, allocated to Pennsylvania. And some of the vaccine might have been received today. I mean, it comes as what one state health official said, ultra frozen popsicle. I mean, it's frozen at the Pfizer at minus 80 degrees centigrade. It has to be defrosted and prepared for administration. So the vaccine that we, quote unquote, we have received this week, we haven't all received and isn't ready to be even given. So you have to take that in consideration. That will be, vaccine we receive today will probably be ready by tomorrow, the Thursday, for actual use. In addition, there is a 24-hour reporting delay from hospitals and federally qualified health centers, et cetera, to our data. And there's up to a 72-hour delay that we have from CVS and from Walgreens. And so, vaccine that was administered Monday and today, we might not know about till the end of the week. So I think that there is a difference between the number that we have and the number that we've given, and ours is consistent with the rest of the country. But I think that there's always going to be a difference because of those distribution issues and the data issues. I think what we need to look at even more closely than that difference is our success in accessing populations, and I think that we are doing that. We know we had challenges over the holidays, but last week and this week we're continuing to ramp up our allocations and our administration of the vaccine, as is the rest of the country. I think you'll find that that's going to continue to get better. Now, as we implement new guidance from the federal government, we'll have more populations to access. That'll help us get vaccine into arms. And then we're hoping to implement the new federal retail pharmacy partnership and be using retail pharmacies in the coming weeks to be able to distribute vaccines as well. So it's going to continue to get better, and we are committed to our mission of getting vaccines into arms and helping stop the spread of COVID-19 in Pennsylvania.
Thank you. Next we have Flora Pastorero from Penn Watch. Go ahead, Flora.
Hi, good afternoon. My question is for the governor.
Yes, sir.
Yes.
Hi, Governor.
Hi.
Based on your comment, when you were talking about the vaccine is safe and highly effective, and you said you're going to get the vaccine and that you can't wait to get the vaccine, based on all of those statements, do you feel that too many Pennsylvanians have been reluctant to get the vaccine, and are you disappointed by that?
I'm going to ask Dr. Chuang to weigh in on that, but here's my sense of this, and Dr. Chuang, you can tell me if I'm wrong. The initial, I think, surveys suggest that there is a less than 60%, maybe less than 50% who are eager to get the vaccine. And there's probably also a small percentage that is just absolutely opposed to it. It leaves a really big group of people in the middle. We're sort of waiting to see how it turns out. And I think the early going of anything, there will be inevitably people who stand back. But I'm actually really confident that as we go through this and as we get through the $100 million where we go out and talk more about this, and give people more confidence that the number of people, the percentage of people in Pennsylvania who really want to get the vaccine will continue to grow. Dr. Chuang, how do you feel about that?
I completely agree with you, Governor Wolf. The initial surveys that were done in the fall, yes, the number of people across the United States who said they would take the vaccine was around 50%. But as those surveys have been repeated, the number goes up each time. So I think as discussions like this about the vaccine are happening more often and people become more familiar about what the vaccine is and why we're recommending it, and as they learn that their healthcare providers and their loved ones in nursing homes and other people are getting it, I think it'll become more and more accepted. So although those initial numbers may have seemed discouraging, I'm actually very optimistic that we're going to have high rate of vaccination interest as we move forward.
Thank you so much. Our last question today is from Davine Quartz from the Beaver County Times. Go ahead, Davine.
Thank you so much for the time today. So my question kind of goes back to our vaccine distribution here. I don't think anybody can argue that we're seeing increasing numbers going out in our larger counties. But my concern and the questions I'm hearing a lot from our readers are about the more rural counties, the smaller counties that don't have a UPMC or an AHN or a Penn State, that are dealing with more community-based hospitals and health systems that are trying to get vaccine out. There's concern about the number of vaccine that are getting to these communities, and there's also anxiety about how that's going to look when 1B hits us in a couple weeks, and we're looking at people 75 and older. We're looking at school teachers, et cetera. What direction is being given to these counties and these smaller health systems, and what would you say to the folks who are in these classes that are worried that they don't know how they're going to be able to get vaccine?
So thank you. It is very important that rural Pennsylvania be completely covered in terms of our vaccine distribution. Now, the first week, we really couldn't distribute to rural Pennsylvania as much because the first week of distribution was only Pfizer vaccine. Pfizer vaccine is the one that has to be kept at minus 80 degrees centigrade, and most of those smaller local hospitals did not have the ability to be able to store it. But as soon as the Moderna vaccine, 1 week later, was available, we started to ship Moderna vaccine to all of the hospitals that wanted to accept it throughout rural Pennsylvania. And they have been getting Moderna vaccine during the last number of weeks and being able to administer it to their staff. And then, of course, in the last number of weeks, we've asked them to distribute it to healthcare personnel that are in their area but might not be part of their staff. In addition, we know that federally qualified health centers, which are prominent in rural Pennsylvania as well as urban Pennsylvania, have been getting vaccine to be able to distribute to their staff as well as other people in 1A. Those other healthcare workers. We know that even some pharmacies that we have been able to distribute some vaccine for the 1A mission. I had mentioned the retail pharmacy partnership, and so that will be starting in the next number of weeks. That was just released by the federal government this week to be able to, for us to work with. And so we'll be working with them, and they will have pharmacies throughout rural Pennsylvania. And of course, Walgreens and CVS are not only vaccinating nursing home patients in suburban or urban Pennsylvania, they're going right out to those rural counties as well. As we work out other methods of vaccination, such as working with PEMA and setting up vaccine clinics and large vaccine sites, we will definitely want to do that in rural Pennsylvania as well. Looking at what we call a vulnerability index to look at disadvantaged populations that might have been very adversely affected by COVID-19 and making sure that we vaccinate them. So we will not forget rural Pennsylvania, and we'll make sure the vaccine is available.